Welcome. Today you will learn about the process of conducting a reflex knee test. Mr. Jones will be undergoing a regular reflex test. Reflex hammer. There are a variety of styles to choose from, but we will be using the Taylor, or also known by the name Tomahawk reflex hammer. The head of a reflex hammer is made of rubber. This helps to ensure that it does not hurt when the hammer taps a tendon. When testing a patient's reflexes, you will need to tap directly on the tendon that connects the bone and muscle you want to test. The tendon feels like a tight strip of tissue under the surface of the skin. You have to hit on the patellar tendon. This tendon is located just below the kneecap. Grab the hammer lightly to ensure that you do not apply too much force when you tap the tendon.
How to grab?
You can grab objects by either pointing at the object with your controller or by placing your controller inside of the object to be grabbed and using the grip button on your controller. The object will remain held as long as you hold down the button and will no longer be held when released.
How do I use? How do I use?
You can use objects by either pointing at them with the beam coming out of your controller or by placing your controller inside of the object to be used and pulling the trigger.
How to teleport?
You can teleport by pressing down on the control stick. Doing so will cause a curved pointer to come out of your controller. At the end of your pointer there is a cylinder. You will move to where the cylinder is on release of the control stick button. Use the reflex hammer on the knee. Reflex testing only requires a single impact with the hammer. This stroke should be done quickly and firmly, tapping the center of the tendon. Tap the tendon with proper force. It does not take a lot of force to make a muscle flex. The tendon should be tapped firmly but not with enough force to cause pain. The goal should be to tap the tendon with the least amount of force possible while still eliciting a reflex. This can take some practice to get right. A condition in which a muscle repeatedly contracts when it is stimulated. And if there's no response, assess whether it is due to an error or a medical problem. In order to ensure that you tap the tendon correctly but no response occurs, you should do it several times. With repeated reflex tests you can ensure that your test results are correct and not due to an error in your method of testing. Having no response to tendon stimulation is called hyporeflexia. Let's compare reflexes on two muscles. Use the reflex hammer on the knee. When testing reflexes, it can help you gauge the response by comparing the same muscle on the opposite side of the body. Comparing the responses can allow you to spot abnormal responses. In order to judge how good reflexes are, most doctors grade them on a scale from 0 to 4. These numbered grades can also be given a plus or minus to indicate additional levels of response. The numerical grades correspond to responses in this way. 0 is no response. 1 is a slight response. 2 is a normal quick response. 3 is a very brisk response. And 4 is an abnormal repeating reflex. Observe the reflex results for diagnosis. If the muscle reacts correctly, the nerves in the muscle are communicating with the brain as they should. If the muscle doesn't react well, then there is an issue in the nerves between the muscle and the brain. This problem could be caused by a variety of issues, so you will continue with additional medical tests to find the source of the problem. This has been an example of the reflex knee test. Feel free to go through the experience again or go back to the homepage and try a different experience.